So that's Plan G. Now, what I want to talk to you about now, drug coverage. We're going to have some big changes with drug coverage this year. So whether you choose the red side, Medicare supplement, and you have a separate Part D plan for your drugs, or the Medicare Advantage side, and your Part D, your drug coverage is included in your Medicare Advantage plan, either way, we're looking at the same basic structure of your drug coverage. Now, with group plans in the past, you've always had your deductible and your maximum out of pocket that include both your medical and your prescriptions. It's not like that anymore with Medicare. They're separate, okay? So your medical portion might have a deductible, and it definitely has a maximum out of pocket for a Medicare Advantage plan. That's one huge benefit that I haven't mentioned yet. You do have a maximum responsibility. So if you have the worst year ever, you pay up to X amount of dollars depending on the plan, and then everything is covered for you medically after that. You have the similar situation with a drug plan, but they're separate calculations, separate numbers. So with the drug plan, every single company, whether it's a Part D or Medicare Advantage, they come up with a list of the drugs that they are going to cover on that plan. They're required to cover at least one per illness class, but they don't have to cover all of them. So that's, again, my job, your agent's job, to make sure that we find the plan that's going to take care of your medications and your doctors the best. So what this list of drugs is called is a formulary. So if you hear that, that's what we're talking about. You have 5 tiers typically, sometimes 6 in Medicare. That's another thing that's a little different from group plans. Tier 1, Tier 2 medications, those are called generic medications. Most medications do have a generic equivalent. If you can get that, if you can tolerate it, that is by far the least expensive option for you. Tier 3, those are brand name medications, and also insulin is on this tier on most plans. Tier 4, those are non-preferred brand name, obviously getting a little more expensive. Tier 5, these are your oncology medications or your specialty medications. They're pretty expensive, as you can tell by the $5 signs. Now, deductibles, which is a total dollar amount that you have to pay before the plan covers you, they are charged by tier, but some plans have them, some plans don't. In some plans, if they have it, they'll only charge that deductible on, say, medications on tier 4 and tier 5. So anything that you have on tier 1, 2, 3, you wouldn't have a deductible and they would cover it right away. So that's something that we'll go over as we're working one-on-one with you. Now, the next screen I'm going to show you will change drastically next year in 2025. So we'll go over this. Keep in mind, this is for 2024. If your plan has a deductible, you'll pay that first. The max that you can have on a plan deductible this year is $545. So if, let's say you have a medication on tier 4, you have to pay that $545 first, and then you'll have a copay depending on whatever that is for that medication on that plan. So it might be another $100, it might be $47, depending on the medication in the plan. So after you pay your deductible, it triggers you over to stage 2, which is the initial coverage stage. And that's when you're just paying that copay. So let's say Ozempic. That's one I see often. Ozempic is a starting dose typical price of about $900 per month. So when you get to this initial coverage stage, depending on the plan, you're either going to pay $11 for that medication, or you're going to pay $47. It's pretty typical for a 1-month supply of Ozempic. After you pay that for a few months, you'll realize something, that behind the scenes, they're not looking at the dollar amount that you're paying. They're looking at the total cost of that medication. So they're adding up the $900 every single time you buy Ozempic. So it's $900 plus $900 plus $900. And then maybe you need some lisinopril or atorvastatin. Those are really inexpensive, but the total price is still going to go into our calculation. So you might not pay anything for that, but $10 here, $20 there, until you should get to this $5,031. Once you get to that amount of total drug costs, not what you pay, not what the insurance company pays, the total cost, that triggers you into the 3rd stage of drug coverage with Medicare called the donut hole and the coverage gap. Now, this stage you're in until your out-of-pocket costs gets up to $8,000. So we're not looking at the total price anymore. We're looking at what you have personally paid this year for medications. Now they're going to go back and say, okay, they paid a $545 deductible. They also paid a whole bunch of copays. Thank goodness they actually do give you a 25% manufacturer discount that they add into that calculation. Once it gets up to that $8,000 amount, then you are at your maximum out of pocket for medications. And then you don't pay anything for your medicine for the rest of the year. This is our first year we've actually had a max out of pocket in many years for medications. Next year, the donut hole is going away. It's been slowly getting smaller. Next year, it goes away. You can see down here at the bottom, individual prescription spend is capped at $2,000. This process always starts over January 1st. It's a fiscal year. It's a calendar year, cycle. Like it says here, most people never even get to this donut hole. Some people, their medication is so expensive that they get to this and fly through it in February. And other people, they're going to get to this donut hole and sit there for 6 months of the year. It just depends on your medications. And of course, that's something we're going to talk through in depth when I have those medications or my agents are meeting with you one-on-one.